Hello, this is Lane Sanderson from the Subiaco Foot Clinic. Last episode we spoke about the CHART acronym that we use to treat patients in that nasty pain phase of plantar fasciitis. We've been through compression, heat and release therapies, and today we're going to go over what I believe is the most important step to getting people back walking, running and doing what they love, and that's active recovery. So this often comes as a surprise to most people, but when you're trying to fix plantar heel pain, complete rest may actually set back your recovery. Now this isn't true for all conditions like a fracture or a rupture or a tear, but the standard plantar fasciitis we're seeing, if we load the plantar fascia, it actually heals much faster. So people are also quite shocked to find what they can actually do without much pain. When I say much pain, I tend to go by the 3 out of 10 rule. So that's anything 3 out of 10 or below is generally okay. There's always going to be a little bit of discomfort with these movements as you rehabilitate to full activity, but as long as it's under 4 out of 10 and there's no lingering pain for 24 hours, you're not likely to have any setbacks in your recovery. So rather than prescribing heel raises off a step that many patients find too difficult and painful to perform, I've embraced the famous 5 technique, which was shown to me by Tim Bransdon of the Running Lab. And this is basically performing 5 slow heel raises with a towel under the big toe, holding onto a wall for balance. Now it's imperative to do this barefoot to properly engage the plantar fascia. And so we go 5 seconds up, 5-second hold at the top, and 5 seconds down 5 times, hence the famous 5. I usually start the patient on 2 feet, and if they're feeling confident after a few days, then they can progress onto 1 foot. There are very few patients who exceed that 3 out of 10 pain using both feet, but for these people we'll ask them to go up on both heels as high as they can before hitting that 4 out of 10 pain, and ask them to hold that position for 20 seconds over 3 sets. The other exercise everyone with heel pain should definitely be able to do is some toe isometric exercises. These are great for activating and strengthening those often weak intrinsic foot muscles whose job it is to assist the plantar fascia. These were also shown to me by Tim Bransdon, and they include 3 movements. So movement number 1, with the rest of the foot planted firmly on the ground, push that big toe into the floor and raise all the other toes off the ground for 10 seconds. Movement number 2 is just the opposite, so we plant all of the small digits on the ground and try to raise the big toe this time, again for 10 seconds. And movement number 3, with the ball of the foot on the ground, try to spread all of your toes so that none of them are touching, again for 10 seconds. So these should be done 1 foot at a time. So that's a general look at how we go about treating people in that nasty pain phase of plantar fasciitis. I hope we've managed to help some people who are suffering from this very common condition, and that you can now get out of bed without fear of those first few steps in the morning. If you have liked this series, please do share and like it on Facebook. I'll be releasing some more videos on the rehab phase of treatment over the next few months.